Well, are you tired of always being tired? Believe me, you are not alone. It is estimated that some 22 million Americans suffer from sleep apnea, and most people don't even know it. You don't have to endure those restless nights, though. My guests today are here to explain how dentists can actually help you get the sleep you need. So I would like to welcome Dr. Sheila Shahamat, the head dentist at Crown Point Dental, along with Tatum Sutton, the sleep apnea treatment coordinator at the office. Thanks for being here, ladies.
Thank you for having us.
So, doctor, most people may be surprised, I think, just to hear that you can go to the dentist if sleep apnea is a problem. So explain to us kind of how that works.
Well, as you know, sleep disorders, including sleep apnea, have become a significant health issue in the United States. It's estimated that 22 million Americans suffer from sleep apnea, and 80% of them are undiagnosed. So obviously something should be done about this. CPAP used to be the only treatment option, and at least the only option that most people know about.
Right.
But according to American Academy of Sleep Medicine, oral appliance therapy is an effective treatment option for people with mild to moderate apnea, also those who are CPAP intolerant. Now, oral appliances can be fitted by just a trained dentist. Not only that, a knowledgeable dentist can recognize the signs and conditions that are associated to sleep apnea, screen the patients for that, educate the patients of their condition, and walk them through their treatment.
So how exactly can these mouth appliances help? What do they do that helps sleep apnea patients?
Well, an oral appliance can keep the airway open by repositioning and stabilizing the lower jaw, tongue, and soft palate. Now, some appliances are made to treat just snoring, and some are intended to treat both snoring and sleep apnea.
So how do you decide, when you see a patient, you go through the screening, how do you decide that an oral appliance is going to work, first of all, and which one for each patient?
Well, based on our clinical findings and every individual needs, we decide what kind of appliance to make. For instance, if the patient is in orthodontics treatment, if the patient has TMJ disorder, or if the patient is a grinder, what's the shape and form of the arch, the size of the tongue, also other factors that we should consider when we are planning to make an appliance.
Do you see some great results?
Yes, we do see very good results with oral appliances, yes.
Okay, well that's good to know. And Tatum, you're going to kind of walk us through the process of getting that oral appliance for sleep apnea. So what happens for the patient?
Well, it starts out with a consultation where we bring the patient in, we check for signs and symptoms. This is followed by a sleep test. The sleep test can either be done in a sleep center or in home. After that is the clinical exam where Dr. Sheila will examine the oral cavity. She'll do all of her examining, some x-rays are taken, and then we take impressions. The appliance is custom, so it fits just that patient. The patient will then come back and receive the appliance. They'll be sent home with the appliance and be ordered to wear it a certain amount of nights. And then when they come back, we can monitor if there's any improvement. So we use a number scale. If we see that score dropping, then we know this appliance is a success for the patient, and we see that improvement, so we know it's working for them.
Yeah, definitely. It's good to know it's working.
Right.
They're probably excited. You're excited. You found a kind of a solution for them. And I imagine a big question for a lot of folks is going to be, does my insurance cover this?
Yes, we accept all medical insurances, so the patient can utilize those benefits that they have, including Medicare. So we coordinate with each insurance company. When we bring the patient in for their consultation, we do a treatment breakdown so there's no gray area and they're sure about everything. We give them all that information.
So your team too at Crown Point Dental, an amazing one. So what would you want kind of people out there to know about what you offer there?
I think the most important thing that people should know is that sleep apnea can be related to so many other conditions. This could be high blood pressure, heart disease, depression, mood changes, excessive daytime sleepiness. These are all things that they should know are even signs and symptoms. And if we educate them on lifestyle changes that they can even work out to help improve their condition, it makes a great big difference.
Okay, and of course they could start with, like you said, the consultation. Come on in. We have the phone number, the website up on screen. So Dr. Sheila, Tatum, I want to thank you both for being with me.
Yeah.
Thank you for having us.